Hello, I'm Dr. Lynn Mielke, and I'm going to tell you 5 critical things that you need to know about concussion and traumatic brain injury. Number 1, what is it? A concussion or traumatic brain injury happens when there is trauma to the head that is significant enough to cause neurologic consequences such as memory problems, disorientation, headaches, visual changes, etc. The vast majority of head trauma is mild head trauma, but even that can have significant consequences, and if there are multiple injuries, the effects are compounded. Number 2, what causes it? A concussion can occur from an accident or injury, such as a car accident, a fall from a horse or ladder, from playing sports such as football or soccer from hitting the ball, or from player collisions, and it is often seen in war veterans from blast injuries. Number 3, what are the symptoms of it? Traumatic brain injuries, or TBIs, can cause behavioral and mood problems, including suicidal thoughts, feelings of rage, anxiety and depression, memory and concentration difficulties, relationship and family problems, and feeling out of control. Number 4, what are the consequences of it? One of the consequences of traumatic brain injury that many people don't think about can be hormone dysfunction. Since the primary hormone control glands for the body are in the brain, brain injury can damage the main hormones for men and women, which causes lots of downstream symptoms and health problems just because of that. Number 5, how do you treat it? The most important first step is to realize that head injury is real and needs to be treated. One of the best things that can be done as soon as possible is hyperbaric oxygen therapy. Putting the brain in a pressurized chamber with extra oxygen is very healing to the tissue, even long after the fact, but the sooner the better. It is also very important to take the right supplements by mouth or IV that can decrease inflammation and enhance brain function and healing, and then to test for and treat all of the hormones that may be affected. Even if the hormones are normal initially, it is important to retest them at least every 6 to 12 months from then on to monitor for hormone deficiency, since it can have a delayed onset. Monitoring brain recovery progress with SPECT scans is also very important. Having a support system and the right counseling and sometimes psychiatric medication can also be very helpful. With the right treatments, such as the ones offered at Optimal Health Spectrums, and seeing practitioners like us who are trained in how to deal with this issue, people can often recover from traumatic brain injuries and continue to have normal lives.